Hello, I'm Lisa, a paediatric physiotherapist for babies and toddlers. I've seen firsthand how small, everyday habits in modern parenting can lead to big issues for our babies. In this podcast, I'm going to show you how to prevent those issues, treat them if necessary, and restore the joy to parenting. Hello and welcome back to the Best for Baby podcast. I'm your host, Lisa Rogers Sargent, and today I'm joined by the lovely Michelle Kuteyi. Michelle is a lactation consultant and is passionate about helping both new mums and experienced mothers with any matters to do with breastfeeding. She has her own company, the Baby Care Consultancy, and is also a senior pediatric nurse and mother herself. So she's lived through it all, both professionally and personally. So Michelle, thank you so much for being here today.
Welcome.
I'm very excited to chat to you.
Me too.
Can you start by telling us a bit about yourself and how you became a lactation consultant and your career so far?
Sure. So I'm Michelle. As you said, I'm a pediatric nurse for over 23 years, and I'm also a lactation consultant. The way I became a lactation consultant was I struggled with breastfeeding myself. I have two daughters, and also got two angel babies, which I miscarried. And when I was breastfeeding, it was an absolute nightmare. It was so painful. The latch was really bad. Like I was literally like crying, like
Sure.
through the whole feed. I went to healthcare professionals, asked for help, and they said, "Oh, breastfeeding is supposed to hurt. You know, your nipples are just sensitive. You'll get used to the pain." So I just sat there through the pain for 8 weeks. And after 8 weeks, it got better. Then I had my second daughter. She was small for gestational age. So she was literally the length of 3 toilet rolls.
Gosh.
And trying to get her to latch was just like, as soon as she latched, my body just remembered that pain from my first daughter. And it was the same thing, 8 weeks of absolute agony. And then she got a bit bigger and it got better. And I breastfed her until she was 3. But
Gosh.
during that process, my friend was like, why don't I become a lactation consultant? Because I'd supported other mums as a nurse through breastfeeding. But when it was my turn, I was like completely failed. So I looked into becoming a lactation consultant. And then as I was learning, I was like, oh my gosh, they actually like completely set me up to fail. Wasn't told about colostrum harvesting because I had gestational diabetes. So that's a risk factor for delayed milk production.
Oh, really?
And yeah, and I'm on the larger side. So again, that's another thing that can delay your milk production. So I should have been doing colostrum harvesting. Wasn't told with either of my pregnancies. So that's why I struggled a bit. Um, and then also, like, as soon as you start struggling, you just start thinking, oh, I'm such a failure, I can't feed my child. All of my friends can do it. I can't do it. Mental health starts spiraling down. Um, and once I started learning, I was just like, oh my gosh, this is amazing. And I'm so passionate about it that like this is the main thing that I do, just supporting mums, not just with breastfeeding, but also with pumping, bottle feeding, combi feeding, finger feeding, however they want to feed. Like I cover all of it. But like that is like my passion. Like that is just I just live and breathe breasts and feeding.
Oh, gosh. Well, I can only imagine you now knowing all of this stuff, just thinking back to if only I had known then going
Yeah,
through those two sets of really, really tough 8 weeks.
yeah.
Gosh.
That was really bad. And that's what a lot of moms say. They say, oh, if only I'd known.
Mm.
Like they see on TV, like someone gives birth and then their baby latches and it's amazing. And like breastfeeding is simple. You have a mouth, you have a baby that has a mouth, you have a breast. The baby latches onto the breast. Simple. But it's not always easy.
No.
Maybe the baby has tension, maybe they have a tongue tie, maybe the nipples are too big for the mouth. Like there's so many things that could go wrong, and then you just start spiraling. So
Yeah.
it's just to kind of like give that guidance and that help.
Gosh. And you're so right, because I'd worked with babies for
Mm,
a long time, and nobody said to me just those few little things, like you've mentioned a whole lot of them. I knew my daughter didn't have a tongue tie. There was some, restrictions that I was working on as a physio with
mm,
her. But I couldn't see anything that would make me think this is the reason. So automatically I thought, I'm the reason. I'm doing
yeah.
something wrong. There's something wrong with my body. So it's not going to change. I have this problem, which means
Mm-hmm.
I probably will battle or not be able to.
Yeah.
And only with time I realized it's because she had such a tiny little mouth. And she's hypermobile, so her coordination was a bit, it just took a lot more practice for her than
Yeah.
the babies. And nobody said that to me. Um, and so it was really, really difficult for about 12
Mm,
weeks before it became easy. Yeah. And if someone had just said that to me,
yeah.
it will, because most of the time I thought, oh, well, I might as well just stop now. What's the point?
Yeah.
Gosh,
And that's exactly it. It does take time. It takes up to 8 weeks for both of you to master the art of breastfeeding. So
okay.
it's like if you had a baby, say the baby's like 2 days old, 4 days ago, how did you feed the baby? You just ate something. And how did the baby eat? They were just chilling, and then food was just coming down the umbilical cord. So both of you are learning. The baby's learning to feed, and you're learning to feed the baby. So it's about giving yourself a break and just remembering that both of you are learning, and it takes some time.
Gosh, that's
Just like
such
if
a
you
valid
think like
point.
going back to nursery, you don't go to nursery on day one and know how to read and write and read novels and stuff. It's a slow process.
Yes.
You learn A, B, C, then you do your phonics, ah,
Yes.
then you do cat, cat, and you keep learning. It's exactly the same with breastfeeding.
Gosh, I never even thought of
Yeah,
that. I mean, it's such a simple, obvious point that you made, that 4 days ago I wasn't doing anything to feed the baby. The baby was just absorbing almost.
exactly.
Brand new skills that do take a while. Yeah.
Yeah.
Gosh, so tell us, you also spoke a bit about colostrum harvesting,
Yes.
because I did it. I was told to do it, and I
Mhm.
did. And I've
Yes.
got some really mixed feelings about the whole thing. So I'd love to hear, to hear what you think about colostrum harvesting. And for our listeners who don't
So
know what it is, tell us what it is.
sure. So colostrum harvesting is basically from 16 weeks of pregnancy, you have the first milk already in your ducts.
From 16?
So from 16 weeks, but
Oh,
you don't take it out from
no,
16
no.
weeks. You take it out from 37 weeks onwards, but it has to be cleared with your midwife. So if you're a high risk pregnancy, such as you've had preterm birth before, you've had a stillbirth, the baby's breech, they have to do a C-section for whatever reason. They might not want you to do that because if it's done incorrectly, it can trigger labor.
Okay.
But if it's a low risk pregnancy, then you're basically just taking out the colostrum, which is if you think of it like every single vaccine and every virus that you've encountered from when you were a child condensed into milk as your baby's first vaccine.
Oh, wow.
So it's full of all of the immune properties, all of the injections that you had during pregnancy,
Gosh.
all of that is in that. And what it does is it's living milk and it coats the whole lining of the baby's intestines because it's got little holes in it. So what the colostrum does is it plugs all of the holes and then it coats it, so that's the microbiome, so that it's then ready for milk to start coming when your milk transitions on day 3. It's ready to digest it and it's protective as well.
Oh, my gosh.
So it's lots of different things. It's people say, oh, it's not real milk. It's milk. It's the first milk and then it transitions into transitional milk. So the way that you get it out, got my breast here. So on the front of your breast, at the nipple, you've got all of these different openings, and it's between 5 and 15. So what you would do is you would do a gentle massage, and then you're going to squeeze on the areola, not on the nipple. And you would just squeeze going all the way around, and then you would have your syringe and you would suck up the milk that comes out and then you freeze it. On the first day, you might get like nothing,
Mm.
but you just keep going. And over time, you'll get some syringes. you freeze it, put the name, the date, and the time, and then you take it to the hospital with you. If the baby can't latch, you then give them that instead of them having formula.
Okay. Gosh.
Yeah,
Okay, my mind is buzzing.
it's buzzing.
So that makes me feel a lot better because I did do it and we used the syringes, but I didn't think of colostrum having a whole new, like a different function to the milk, almost
Mhm.
preparing for the baby to be able to have the milk. Um,
Exactly.
and so if you've been colostrum harvesting, does your body continue to produce colostrum? It won't then change quicker to milk because you've taken
No,
out, you know?
not at all. So it changes to milk after you've delivered. So once the placenta is out, that then reduces some of the hormones and then it will trigger the milk hormones to start going up and then it will start to change it. But it can take between 48 to 72 hours to go from colostrum to transitional milk.
Okay. Gosh, the body's
Mhm.
clever.
It's very clever.
Oh, that's incredible. Sure. So if you don't colostrum harvest, the idea is you will be trying to feed your baby and you might be lucky and your baby latches on and takes in that colostrum
Yeah.
naturally and then will switch to milk. What
Mhm.
about people who from birth aren't able to breastfeed or choose not to breastfeed and go straight to formula feeds and the baby has not had any colostrum? Does that have a detrimental effect on the baby?
It's a very what's the word,
Okay.
controversial area. So for some mums, they choose not to breastfeed, and that's their choice. So if they go straight to formula, that's absolutely fine. That's their choice. They won't get the immune properties that they would get from having colostrum or from having breastfeed, but they would still be healthy.
Okay.
Whereas some mums choose they're just going to give the colostrum and then they're going to go on to bottle feeding because they want those immune properties for the baby. And some can't latch, but you can still colostrum harvest after you've delivered.
Okay.
So that's what I did. The midwife actually milked me, which was quite funny.
I had the
But we
same.
managed to get like 2 syringes out, and that was all the colostrum that my daughter had.
Okay.
Yeah.
Okay. It is, yeah. I think it must be so much more common than we realize because
Hmm.
I've spoken to lots of people since, and I just remember I was in hospital for 3 days. I had a cesarean, and yeah, all the nurses actually coming in and milking me, squeezing, and then to the point where it was the milk was starting to come, and it was little cups they were squeezing out and feeding
Yeah,
her with. Gosh,
that's great.
yeah.
That was a very good experience.
Yeah, I mean, it was. Thinking back, all I remember it was a very painful experience, but
Yeah. It was very, it doesn't need to be that painful.
I know the way you were showing is quite different. I mean, I squeezed
Yeah.
really hard trying to get.
I was there like,
Yes.
I was like,
Oh,
okay, no,
oh
no problem. But the milk came out, so.
God. And so you spoke briefly about difficulties that the baby might have and the mum in the learning days. Are there
Mhm.
kind of common difficulties or common mistakes that you see when people are battling to get their baby to feed?
Yeah. So the most common issue is the latch. So I will get my puppet. This is Lacton. Everything is lacked because it's to do with breastfeeding. So the most common thing is the baby's just latching onto the nipple. So
Okay.
when the baby latches onto the nipple, it's going to be excruciating because we want the baby to latch onto the areola, not just the nipple. So when they latch onto the nipple, they're not going to get a lot of milk. They're going to get very frustrated and come off the breast and still be hungry. And the nipple could sometimes be squashed.
Okay.
So it looks a bit like a lipstick. It can get cracked, or it can just be really, really painful. So the first thing is if the baby's latching and it's painful, we need to look at the way that they're latching, but also look at the mouth if there's any restrictions. Like you said, your daughter had quite a lot of tension. That can be a common cause. The baby's not able to open their mouth properly, especially like babies that are either C-section or if they've had ventouse or forceps because they squash their face and so the nerves can be compressed with it. So what we do is called chins. So C is close. You hold the baby close to you. So the baby should be close to the breast. You don't want like a big gap. So it's like the baby's almost having to reach for the breast. You want them nice and close. Then H is head free. We don't hold the head when the baby's feeding. We support their neck. So you support their neck on your arm like this or with a nursing pillow. Then I is in line. You want the baby completely in line, not on their back, turning their head like this.
So what do you mean by in line?
So we want the body straight.
Okay, so in line with their head.
Yeah. So head, shoulders, knees, and toes all facing the same way.
Ah,
Often we get there, the baby's on their back and they're turning their head to the
yes.
breast. We don't want that. We want them in line. Just like when you're drinking, you don't go like this.
Yes.
You bring the drink in front of you. So we want the baby completely in line. Then N is nose to nipple or chin to skin. So nose to nipple looks like this. Then the baby will lean back, open their mouth really wide and latch. So they've got the areola and the nipple in their mouth. Because we want the nipple to end up right at the back, which is the soft palate.
Oh gosh,
If the nipple's at the front, which is the hard palate, that's going to cause a lot of
it
pain.
hurt. Yeah.
Yeah. So that's why they need to have a wide open mouth to latch. Or you can do chin to skin. So the chin on the breast, up and over, and then they have a nice latch, and then they feed.
Gosh.
The important one that's always missed is S for supported. So you want the mum supported. You don't want the mum like this, all hunched over with the baby. You want the mum to be sitting, lots of pillows under both arms and supported, and then the baby supported. So we want the baby's neck, shoulders, bum, and feet supported like this,
Okay.
or on a pillow. If the baby's not supported, it triggers the Mora reflex. So they go like this, they think that they're falling. If they think that they're falling, they can't latch because they're scared. So
Okay.
you want them nicely supported. So hold the baby close, in line, head free, nose to nipple, and then supported. And then that's how you'll get a good latch.
Gosh. I mean, that's incredible. That in itself resolves like 90% of the problems I encountered just in one, what do you call it?
Just in one thing.
Whatever it's
Yeah.
called, algorithm. What I don't know what the word is. I keep wanting to say aneurysm, but whatever it is. Yeah.
Mnemonic.
One, yeah, that thing where there's the capital letters. Gosh,
Yeah.
and can you explain why they have to be head free?
Yes, I can do that. So imagine if you were eating and then I came and put my hand on your head.
Okay.
You would be like, what are you doing?
Yes.
So they feel quite uncomfortable.
Okay.
So that's one of the reasons. The next reason is when they're latching, they tilt their head back a little bit so that they can get a good latch. If you're holding their head, they're just going to go like this. So that's going to be on the nipple, which will be painful.
Gosh.
A lot of babies, when they're feeding, they bury their nose in the breast. And then if they can't breathe, they're going to move their head. But if you're holding their head, they can't do that.
Okay.
And then towards the end of a feed, the baby's either going to spit the nipple out or they're going to fall off milk drunk. So again, if you're holding their heads, they can't do that. So then they could start to get a little bit upset.
Okay.
So we want to just support the neck, but not hold the head.
Gosh.
Yeah.
That's amazing. You'd think like it's relatively simple information that could be
Mhm.
distributed, ahead of time.
Yeah.
Gosh.
And it's something that like it's drummed into your head. Like, hold the baby's head because
Yes.
their necks are so weak. But these babies that are like Gen Beta or Gen Beta, however you pronounce it, they're coming out with crazy neck control. Like they're like this looking around the room, like from birth. So they don't really need the neck support.
Gosh, why do you say that?
No, we're just finding that babies born
See?
like from 2025 onwards, their neck control, they're very strong, they're very advanced. They're always giving side eye like this, like looking at you. They have like crazy temper tantrums, hate having their nappies changed, always got hiccups. If you look through
Yes.
Instagram, you'll see all of the same things. And when I go to a family and say, "Oh, are they doing this and that?" They're like, "Yeah." I'm like, "It's their generation."
Gosh, I wonder if it's like
Yeah,
overstimulation or something,
possibly.
or the maternal state. I don't know. That's incredible. Very interesting. I'm going to do
Mm.
some research on that because I wasn't aware of
Yeah,
that.
yeah, it's
Gosh.
Gen Beta.
Sure. Um, okay. So, are there any kind of common mistakes or difficulties people are having outside of latching with breastfeeding?
Yeah, the main one is milk supply.
Yes.
So they either think they have a low milk supply or sometimes they do have a low milk supply. And it's knowing whether the baby has had enough. Like, how do I know that the baby's
Mm,
had enough milk? Obviously, with a bottle, I can see how much they've had, but from a breast, how do I know how much they've had? So the way that we check this is by their nappies and also by how satisfied they are after a feed. So basically, from day one, it's one wee and one poo for each day up until day 5. And then we want 5 to 6 wees and then at least 3 poos. So
okay.
if your baby is having 5 to 6 wet nappies and at least one poo is like the absolute minimum that we would want, then we know that the baby's getting enough milk. The
Okay.
color of the poo also gives us an indication. So day one, it will be black,
Yeah.
black, sticky, tarry one. Then day 2 will go from black to dark green. And then day 3, it should be going from a dark green to a pale green to yellow. So if we see a baby on day 5, day 6, and they still have green poos, then we know that they're not getting enough milk.
Okay. And is that
And then
because
it's
the milk would be flushing all of that out?
exactly, yeah.
Okay.
And you'd also find that they might be a bit jaundiced as well because they're not
Yes.
getting enough milk. Yeah.
Okay.
So we're looking at the wees, we're looking at the poos, but we're also like, how is the baby after a feed? If the baby's settled, then they've got enough milk. If the baby is still like rooting, putting their hand in their mouth, very unsettled, then that's another indication that they're not getting enough milk.
Okay.
But what we're finding is, see with these holes, so these are the openings of the ducts, and then these are the ducts.
Okay. Oh, wow.
Yes, I did make it.
Did you?
Yeah.
That's incredible.
They were
Oh,
selling it for £50. I was like, no, you could just sell me the pattern.
gosh,
I'll make it
I'm
myself.
so impressed.
Yeah.
Gosh, so for our listeners who aren't watching, Michelle's showing us the inside of the breast, the long tube of the duct and how it ends in a whole network of, I don't even know what that is,
Ducts.
ducts.
Yeah.
Yep, and there's an
So,
enormous amount, yeah.
and then at the end of the ducts, there's cells. So this is where the milk is made.
Okay.
So when you're a first time mum, all of these ducts are closed. And the way that they open is from the baby sucking on the breast. If the baby can't suck on the breast, then by pumping.
Oh,
So they all open so that on day 3, when the mature milk comes in, it's able to go down the duct and out of the nipple into the baby or into the pump.
okay.
But if the baby isn't latching and the mum isn't pumping, these ducts remain closed. And so that affects the milk supply because the milk can't get out because it gets squeezed from the cells and then it goes down and it gets stuck.
Oh
So
gosh.
that can be one reason why, but they can also get blocked. So this is a blockage. I call it cheese. So
Okay.
it's like it's like a ball of mozzarella that's stuck in the duct, and then it blocks any more milk from traveling down.
Gosh.
So this is called block ducts.
And so those ducts can be opened after day 3 at any time if you start to
Yeah.
pump. Okay.
And they can get blocked at any time during your breastfeeding journey.
Okay.
So a lot of moms that I go to see that think they don't have milk, they actually have blocked ducts. So we do a very gentle massage. And once we've done that massage, it then releases it, and then you get a lot more milk coming out. And then the baby goes on, and the baby has an amazing feed, and then comes off milk drug.
Okay. And
Yeah,
probably then when the baby is able to then have that enormous, amazing feed, it just really opens
exactly.
everything else up again.
Exactly. So block duct is quite a common one. And sometimes it's the baby has a restriction. So it's not always a tongue tie. It can just be like tension
Mm.
where they're not able to latch properly. And so because they're not latching properly, they're not removing enough milk from the breast. So if they're not removing enough milk from the breast, some of it will start to get stuck and then it can start to reduce the milk supply.
Okay. And for the mother, if the ducts have never opened or if some of them are blocked and she's got the milk but it's not coming out,
Mhm.
is that painful?
Yeah.
Okay.
So it would be depending on what stage you're in. If it's like within the first week, you would feel quite engorged. So your breasts would be really hard. They'd be quite warm and it would be uncomfortable. It would feel like a lot of pressure. So the way that we relieve that pressure is by removing milk.
Okay.
If it's later on, so like after weeks, say like 2 weeks, 4 weeks, whatever, then you would feel like a lump
Okay. Yes.
and then you might get some changes in the color. So if you're a fairer complexion, it might go red. If you're a darker complexion, it might be darker and look a bit bruised.
Okay.
Um, the breast would be very tender, and then you could then lead into mastitis. So if you think of plug ducts as the little sister, and mastitis is the big sister. So
Okay.
we don't like the big sister.
Okay.
So as soon as we identify the little sister, we need to get rid of her before she calls her big sister to come in.
Oh, I see.
Yeah. So it can lead to mastitis, yeah,
Okay.
which is a breast infection.
Yes. And the only way to open those ducts is to pump or to have the baby drink.
Yeah. And
Okay.
then if it's identified, then we do a gentle massage, which is called therapeutic breast massage in lactation. So it's a very gentle, it's like a lymphatic kind of massage, and it's combined with breast gymnastics.
Breast
And then we do
gymnastics.
gymnastics, yeah.
Oh.
You get the breast up, you tuck it in the air and stuff. No, really. It's it's different types of rotation. So
Oh,
you're rotating the
wow.
breast around and then it goes up and down, side to side, and taps. And that's just to help open the ducts.
I mean, that's incredible. Just asking there, I thought you were going to say yes, the only way is to pump, and that's that.
Mhm. So
God.
you still pump and feed,
Mm.
but you can do that in conjunction with it to open the ducts a bit faster.
Okay.
Yeah, and you can also breastfeed on top of the baby so that the breast is hanging down. So you'd be on all fours on top of the baby, and then the baby's feeding from underneath. That's called dangle feeds. And that helps, like gravity is working with
Yes.
you to help open the ducts.
Gosh, I mean,
And you could also do pumping that way as well.
okay. Because that can't be terribly comfortable, I'm thinking, on all
No,
fours. But I suppose if you're
yeah.
desperate, it is helpful.
Or you could just like lean forward and then
Okay.
have the baby underneath.
Yes.
Especially if it's like a C-section, going on all fours is
No.
not going to be a
Yeah.
great idea.
Okay.
Yeah.
And it's using gravity, obviously, to help.
Exactly. Yeah.
Gosh. So, okay, we've looked at the latching difficulties. We've looked at the
Hmm.
ducts being blocked or not
Yeah.
opening. What else do you see that contributes to difficulties with feeding?
So milk supply, we'll go back to milk
Okay.
supply.
Yeah.
Um, if you think of a hot day like today, you'd find that you would sweat more and wee less because your body is
Yes.
constantly trying to balance your fluids just for like other bodily functions. So if your milk supply is low, we would need to look at what is your diet like. Are you eating and drinking enough? Because if you're not eating and drinking enough, that can have an effect on your breast milk because your body is trying to protect your body. While you're pregnant, the body's protecting the baby. After the baby's come out, the body's now protecting yourself. And so if you're getting
Okay.
dehydrated because you're not drinking enough, your body is going to look for where are we losing fluid, and that'll be the breast milk, and it will start to reduce it down.
Okay.
Another reason is sometimes people are not feeding often enough. So they're stuck on, okay, the baby must feed every 4 hours. And so they're very strict and regimented. Every 4 hours, the baby feeds. But in the earlier days, the baby needs to feed a lot more frequently than that. So we go based on how the baby is. So that's the feeding cues. So when the baby tells you that they're hungry, that's when you feed, not every 4 hours. So if you don't feed frequently enough or pump frequently enough, that again will affect your milk supply.
Okay.
Another crucial one is not feeding overnight. So maybe you have a relative that's staying with you, and so they would give the baby a bottle overnight while you sleep, maybe like 6 hours or so. That one is crucial. Like night milk and night feeds are crucial to your milk supply.
For
So
how
if
long?
you
Just in the early days or?
That's more in the early days. So like I do like in the first 8 weeks. As the baby gets older, they're gonna start to drop
Yeah.
as many night feeds. They might just have like one feed. But like some babies or some toddlers at like age 2, they still have a feed overnight, but it doesn't control the milk supply as much. But
Oh,
it's more like in the early days. So it's
I'm
like you
having
think,
like,
oh
oh,
yeah,
I'm
they're
feeling,
helping me so I can sleep. But
gosh, I'm having all these like
yeah,
terrible revelations of all the things I did wrong. Oh, wow. Okay, so night feeds is a big thing about
it's a
getting
big
enough
thing,
food
yeah.
to your body to produce more milk.
Exactly. So if you want to have like that break overnight, ideally you should pump while the baby is having a feed. So ideally it should be like at least every 4 hours.
Okay.
So if you're gonna have like an 8 hour stretch where you're gonna sleep and somebody else is gonna have the baby, so you just wake up twice, pump, and then put that milk in the fridge and then go back to sleep. Just because your body needs to know that there's still a baby to feed.
Gosh.
Yeah.
Sure. You
It's
also
lots to
said
know. Hmm.
the 4 hour thing. And again, someone had said, and I thought that was correct, 4 hourly. So I had this tiny baby, and I thought she doesn't need to feed more than every 4 hours.
Hmm.
And from, yeah, brand new, every 4 hours, I mean, and I would have to wake her. She was very sleepy and jaundiced. And so
Yeah.
I just, yeah, and it was a long time before a friend of mine actually said to me, I don't think you're feeding her enough. You need to
Hmm.
feed more regularly. And when I did that, the jaundice went.
Exactly.
But we had, I don't think it was 8 weeks, but probably quite close where, yeah, she just didn't get fed very often, if I think back.
Yeah.
And certainly
And
through
it's because of what you
night.
were told.
Yeah.
So we go by what we're told
Mm.
by healthcare professionals or by relatives, aunties, grandmas, and you just kind of follow what they say. But
Yes.
it's about getting the information out there, which is why we do podcasts like this to get that information out there. Because not everybody's able to attend antenatal classes,
No.
just depending on what area they're in. Maybe they can't get to the hospital, maybe they've missed it, they've got childcare issues. So it's just getting that information out
Yeah.
there that is the baby feeds when they show you that they're
Mm.
hungry.
And I think also because I went to antenatal classes, you just have
Hmm.
so much information coming and you're pregnant. So your hormones are all over the show and you only remember some things. And,
Hmm.
you don't understand or you don't know it until you go through it. So yeah, I just feel like I wish there was a way to make this more obvious for people, or the facts that people remember, because I think it would have
Yeah.
changed my journey drastically.
Even mine.
Yeah, yeah, you too.
Definitely.
Sure.
Yeah,
Okay. And
that's good.
so you've spoken about ways to ensure your supply is coming or to increase your supply. Are there
Mhm.
certain foods that you think helpful?
I knew that was good. Okay, so there are some foods that are believed to help with milk production. So your things like oats and fennel seeds and fenugreek and they don't really tend to do research into them to see whether they actually work. Sometimes it's more like you think it's going to work, and then it maybe like changes your mindset, and then it has a kind of like a,
Placebo.
what's the word, placebo. That's exactly the
Yeah.
word, thank you. It has like a placebo type effect where you think, oh yeah, I'm taking this, I'm going to have more breast milk, so you relax,
Okay.
and then when you relax, you're then able to produce more milk. Whereas if you're stressed out, it actually blocks the milk production hormones. So then that would reduce the milk supply. I
Okay.
think off the top of my head, the only one that they've done some research on was moringa. So they
Okay.
found that in some cases it can increase milk supply. And then fenugreek in some cases can decrease milk supply.
Oh
And
gosh.
that's one that they have a lot. So, and there's lots of all these like teas and coffees and
Yes.
cookies and
Cookies.
porridges and all of that kind of stuff. The main thing that increases your milk supply is one, staying hydrated, and two, effective milk removal. So whether that's by baby or by pump. So if we think of it like in the first week, it's your milk supply is controlled by hormones. After a week, it's supply and demand. So if you make a demand on the breast milk, it will supply you more. If you don't make a demand, it won't. So I think of it like a petrol station. If you drive into a petrol station, they've got like 5 million liters of petrol. But if you don't take the nozzle off and then take the nozzle, put it into your car and press it, you're not going to get any petrol because you're not making a demand on it. They
Yes.
have petrol, but you're not demanding it, so you're
Okay.
not going to get any. But if you press it and you get the petrol, then you're fine. You drive around for a little bit, the tank is low, you go and you refill it again. So it's exactly the same with breast milk. You have to make a demand. So it's again back to these cells. You have to tell these cells that there's a baby that needs milk. So whether that's pumping or it's breastfeeding, you make a demand, it will continue to make the milk.
Okay.
But if you don't, then it's not going to. So you could take all of the cookies and all of the teas and the porridges and the hot chocolates and all of that. But if you're not pumping or feeding regularly, they're not going to work. So
Okay.
they'll work in conjunction with
Okay.
that. Yeah.
Okay.
So
Yes. I was given a family hand-me-down recipe from a lady who lived on our street of the most revolting cookies, and I used to make them with brewer's yeast in them. So they tasted
yes.
revolting. And
Yeah.
I would stand for hours making them with this baby strapped to me. And it was
Oh,
terrible
bless
cookies.
you.
But then I must say it did get easier, and I did breastfeed for a long time. So
Yeah.
I think maybe it did
So
help a bit.
there's so many things that like in other cultures, things like fish. Where I'm from, we have a soup made with peanuts
Oh,
that's believed to help with breast milk. Other cultures, it's like a porridge made with fermented cassava,
okay.
or fermented maize. There's so many different things. They say,
Yeah.
oh, you have to have this, and then it will help your milk supply. So it varies from culture to culture. But the main thing is the baby's feeding or you're pumping regularly. So we
Okay.
want like 8 to 10 in the first couple of weeks, and then you can drop that down. But
Eight
at
to 10?
least 8 to 10 feeds.
Okay.
Yeah, so small babies, their tummies are very tiny.
Yes.
So that's like they'll feed 1 week and they're empty. So they could be feeding every like 1 to 2 hours at first. And then as they grow, their tummies get bigger and then they'll have longer gaps.
Okay. So when you say 8 to 10 feeds, is that in how long
That's per day.
per day? Okay.
Yeah. So it's like every 1 to 2 hours.
Okay.
So
Okay.
that's when they're at the newborn stage, they're constantly feeding.
Yes.
Yeah.
Gosh, yeah, the opposite of what I did, sure.
But you didn't know.
No. Oh, goodness. Well, it's amazing to have you here saying this, and I'm
No,
certainly
thank
going to be
you.
telling every parent I come across as well. With that, can you then tell us what is cluster feeding and
Okay.
the difference between those early days when they are feeding so regularly anyway?
Okay. So cluster feeding is basically the baby binge feeding. if we put it that way. So they're having lots of feeds, and they're normally like between every 30 minutes to an hour. And they can be in the early days. The reason they're cluster feeding is because they're opening the ducts for you.
Oh,
And that's how the ducts get open. So like day one, day two, day three, they're cluster feeding because they're trying to open all of the ducts so that when the mature milk comes in, the milk will be able to get through and they can feed.
okay.
After that, it's more like a comfort thing. So let's say they've got a growth spurt coming up. So as you get to like 6 to 8 weeks, they do a lot of cluster feeding because they're about to have a leap. They're gonna have lots of brain development and skills as well. Sometimes it's a comfort thing. Some babies cluster feed in the evenings, every evening, and some babies only cluster feed maybe once or twice a week. So it varies. There's no like hard and fast rule when it comes to cluster feeding. But it's just the baby needs like a bit more food, and so they're cluster feeding. However, cluster feeding can also be an indication that the baby isn't getting enough milk.
Okay.
So either there's blocked ducts, um, there's an issue with the milk supply, such as the mum still has some of the placenta retained,
Oh,
and so that's affected the milk supply. Maybe there's an undiagnosed metabolic condition that's affecting the milk supply. Maybe she's bleeding a lot. Maybe she bled a lot during or after labor, and so that's affected the pituitary gland, and so that's then causing the milk supply to drop. Or the baby isn't actively sucking and getting enough milk.
okay.
So that's why they're feeding because they're constantly hungry. So if the baby's constantly cluster feeding, then we would have a look at that.
Okay.
Yeah.
Okay. God.
But that would normally come with like cluster feeding, jaundice, or weight loss, or the nappies are not as wet or they're not as frequent. So then it would be combined with that. But if they're just cluster feeding, then
Okay.
it's tiring.
Okay. And
Yeah.
you said the cluster feeding in the beginning is opening those ducts. So is
Yes,
that therefore a good thing or a normal thing for them
it's a
to do
normal
it?
thing. Yeah.
Okay.
So on the first day that they're born, they might just have like between 1 and 3 feeds. But the next day, they'll be on you constantly. It might feel like every half an hour they're constantly on. And that's just because they're trying to open the ducts. They know that they need to open the ducts. How they know? Who knows? But they
Okay.
know they need to open the ducts. And how they're going to open the ducts? By sucking.
Gosh.
So that's why then if like the baby it was unwell and the baby's been taken to NICU or SCBU, we would then get the mum to be pumping regularly. So we need to have
Okay.
the mum to pump like every 2 hours in order to get the colostrum to feed the baby, but also to open the duct so that the milk can come out.
Gosh. So maybe other mums are more instinctive and know to do this. But if someone had said to me, literally just in the beginning, put your baby on, give your baby opportunity to feed as much as they can, particularly on day two, your ducts would open,
That's
baby would be practicing, and it would kind of eliminate a lot of issues.
yeah. So we just say now, like every time the baby cries or make a noise, put them on the breast. The breast fixes absolutely everything.
Yes.
And the more they practice, the more they learn. So
God.
with breast milk, you can't overfeed a breastfed baby. There's a hormone in the milk that lets them know they're full, and then that's it. So then they'll come off, and then like there's all this milk in the mouth that pours out. It's because the hormone has said that you're full.
That's enough.
Whereas with formula, they don't have that hormone, and so they can overfeed, and sometimes they throw up because they've had too much, and their stomach
Oh,
can't hold anymore.
gosh.
So that's why I would just say keep putting the baby on the breast. It just fixes everything.
Yes. I don't know. I feel like there's almost a judgment. Maybe it's because we deviated from almost natural mothering, you know, and now it's coming back again. But there was this real judgment of, oh, you shouldn't feed so often. Oh, that's a bit strange. No, I think you need to increase the gap between feeds. And it was like, I'm doing it right that my baby can go this long in between feeds. And
Hmm.
certainly don't just breastfeed if there's a niggle or if the baby's crying, look what else
Yeah.
is wrong. Or, yeah. Oh,
Because sometimes the reason why the baby's a little bit unsettled is my niece said it to me. What if the third toe on her right foot is itching? How is she going to tell you that as a baby? She's just going to be like, "Ooh," and cry.
yes.
So, like, breastfeeding just solves everything. It's too hot. It's too cold. What is that light? What is that smell? What is the
Ye-
sound? I don't like these clothes. They feel weird. My nappy's wet. But there's so many things that they're dealing with because they've been sheltered in your womb. Everything was muffled and it was dark. Now there's all of these lights, there's all of these sounds, there's the Hoover, there's grandma, grandpa come in, and grandma smells like lavender, all of these things, they're just constantly being bombarded,
Mm,
that they just need that comfort from mum, and that's their safe space. They know the sound of your voice, they know the sound of your heartbeat, they know the sound of your breathing, they know your smell. And
mm,
so when they're there, they're just like, oh, okay, I'm safe. And so then breastfeed, and
mm.
I'll have a little drink, you
Yes.
know?
And I suppose with a bottle, by giving a bottle up close, they're getting all those, your smell, your sound, all of that.
Exactly.
But you can overfeed them if it's formula. So you would be,
Yeah.
but expressed milk, can you overfeed with expressed milk?
No, it's
Or
still
got the
got the
hormone in
hormone in
it.
it.
Okay,
Yeah.
so you'd be a bit more aware of that if it was formula.
Hmm. So
Um,
if it's formula, you just follow the packet. So whether you're given the ready-made ones or you're given the powdered ones, you would just follow what it will say, like at this age, give 60 mils or give 30 mils or give 1 ounce or whatever, and
okay,
just follow that. If the baby's still showing hunger cues after that, then you could give a little bit more, but you wouldn't like make a full bottle for every food.
okay, okay. Gosh. Oh,
Lots to learn, isn't
there is
it?
so
Just
much to learn. I'm just, yeah, you're blowing my mind completely. And
yeah.
gosh,
And then with the bottle feeding, like the same way, just like what you said, to get that same experience, you would hold the baby close so that the baby can hear your heartbeat. And then you're feeding so that, let's see if I can move it a little. Yeah. So you're feeding the baby like this. So that they are at the breast, they can still hear your heartbeat and they're feeding like we don't like people to like hold the baby outwards and feed this
yes,
way. You're not getting that same bonding because there may be a reason why they've chosen to give formula. It could be maybe there's a history of abuse, and so they can't have that kind of sensation. Um, it could be for medical reasons, it could be for surgical reasons, maybe they've had a mastectomy or something like that. There could be whatever reason, we don't judge, but you can still get that same closeness by holding your baby close, feeding, holding their hand, talking to them. It should still be a bonding experience whether you're given formula or express milk.
okay.
So it's really important, yeah, just to have that bonding time. Some dads um even bottle feed with their tops off so the baby's still getting skin to skin. You can do that as well. There's
Yes,
no reason why. Because they get that skin to skin and it's all calming. It's calming for both of you. It helps to regulate both of you.
yes.
So
Oh,
yeah.
oh. And do you have any tips for parents who are wanting to transition from breast to bottle, or even just one bottle a day, or
Mhm.
any rules around that?
So Um, the main one is if you can get help, because if the baby's used to breastfeeding, they're not going to be interested in the bottle because they can smell the breast milk on you.
Okay,
So if you give the baby to somebody else, it normally makes it a little bit easier. And then we want it to be an enjoyable experience. So we don't want to be like forcing the baby, no, 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 you must have it kind of thing. Um, we want them to enjoy the feed,
okay,
and then you want it to be quite similar to breastfeeding. So you put the bottle on the top of their lip so they latch onto it. So they don't then start to prefer a bottle tea because they can just go and latch.
okay,
And then when they go back to the breast, they'll go, and the mom's going to go because it's going to be very painful. So
okay,
you want it to be as similar as possible. And then just like a nice, calm environment, not too many distractions, just allow the baby to feed. If the baby gets very distressed, stop and then try again after another day or two.
Oh,
So with some babies, it takes a while because they're used to skin, not plastic or silicone. And so you want it to be like a gentle transition. Otherwise, they could have a bottle refusal. And especially like if you're going back to work and you need them to have a bottle,
yeah.
if you didn't introduce it gently, then there's going to be issues with that one.
Okay.
Yeah. And then also, if you're going to be doing breast and bottle, want paste feeding. So the bottle is horizontal and then the milk is halfway at the bottom and then air at the top. And then it's as they're sucking, it's like this. And then once they stop sucking, you lower it so the milk stops. So it's if I suck, I get milk. If I don't suck, I don't get milk.
Oh,
So that when you go back onto the breast, if you suck, you get milk. If you
yes,
don't suck, you don't get milk. Instead of the traditional milk, 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 milk,
yes,
milk, milk. Then when they go back on the breast, they're like, hang on, it's taking too long. So we used to call it nipple confusion, but
yes.
it's flow preference because the flow of the bottle is faster. So
Okay,
if you can mimic the breast with the bottle, then it's easier to
okay,
transition. Yeah.
yes, okay.
If they're older, so say like 6 months and stuff, what we do is they've got these balls that have little holes in them. And so you put the teat into the hole and it becomes a toy for the baby. So as they're playing with it and they're sucking on the teat and then they realize it's not scary, you can then transition from that to a bottle.
Oh, I
So
see.
that's for the ones that they've tried to do that and it's not working.
Okay. Gosh, I've
It's
never even heard
crazy.
of those.
Yeah. They're like a ball, and they just have lots of holes in them, and
Okay.
then you just pop it in.
Hmm.
That
Gosh.
on that's quite right.
And do you have any breast pumps that you always recommend, or you just work with whatever people have?
I just work with what they have. But we ideally in the first 8 weeks want hospital grade because the suction is a lot stronger. So in the first 8 weeks, we're trying to establish the milk supply. So if the pump that you're using doesn't have a strong enough suction, it's not going to remove enough milk and we're going to have issues. After that, you can then move on to the fancy ones that you put in the bra, that you see all over like social media and TikTok and all of that. But we don't recommend like specific brands. We just say hospital grade.
Okay.
And then you don't have to buy it. There's a lot of places where you can rent it from. Some pharmacies rent and other websites rent it for cheaper than getting it directly from the thing.
Oh gosh. Okay.
But what we do say is to get measured properly. So there's a new way that we measure, like the traditional way would be to measure the base of the nipple. So you'd be like a 21, 24, 26. But now we measure the face of the nipple and then the height.
Oh,
And then we actually connect you to a pump and then try out all of the different sizes. So most women are between like a 12 and a 15, but they're using like 24, 25.
oh gosh.
Yeah. So pumping shouldn't be painful and your nipple should come out the exact same size and shape as when it went in.
Okay.
Yeah. So that's just one thing to look for someone that does like proper flange fitting.
Okay.
Yeah.
And so you would be able to find someone, you'd just look that up to fit, and then you could go and buy accordingly.
Exactly. Yeah.
Okay.
It's something that I do as well.
Oh, okay. And in terms of bottles, are there any, there's plastic, glass, microplastics. Do you have any opinions on this?
I would just say use one that you feel comfortable with. With regards to the teat, we like the ones that are triangle or sloped. So with those ones, they work best for babies that are breastfeeding because they have to latch onto them.
Okay.
If you have the ones like the traditional ones or the ones that are a bit sloped, they can literally without actually opening their mouth to latch, and then you have difficulties going back from breast to bottle.
Okay.
But yeah, it's that's a personal preference.
Yes.
But if you're brave enough to have glass, go for it.
Yes.
If you're like, break it, then get plastic.
Yes. Okay.
There's no like specific brands, like supermarket brands are just as good as the more well-known ones,
Yes.
but just ideally like the slope tea.
Okay, that makes sense. Yeah.
Yeah. And then just make sure it's the right size for your baby. So they go from like extra small all the way up to size 3. So it's the flow of the milk that's going to be affected. So if you have a newborn, you'd want an extra small or small if that's the lowest that they have. You wouldn't like start on a size 1.
Okay.
Yeah,
Okay.
just because they can choke.
Yes. Okay.
Yeah. But
Gosh.
yeah, we don't recommend brands.
Okay.
We're not allowed to.
Okay.
So another thing is there's a lot of influencers on social media that have something called oversupply. So their bodies are making too much milk. So they would be wearing like the wearable pumps, and they'll come out and say, "Oh, I just pumped like a liter of milk. Oh, it's so amazing." And then you would have another mum at home who's pumped and she's got maybe 20 mils of milk. And so she's then going to think, oh, I'm failing because the mum on social media just pumped a liter in like 10 minutes and I'm pumping like 20 mils in half an hour. And it's because they have something called oversupply. So their body is making too much milk, whereas your body is making enough milk for your baby. And some people find pumping so stressful that it releases so much cortisol that it literally blocks their body from producing milk. Whereas when you're feeding your baby, you've got that connection with your baby. You love your baby. So you're releasing more oxytocin, so you would release more milk. Whereas the pump is plastic, it was made in a factory somewhere, and you hate it because maybe it's the wrong size and so it's painful. It just makes you stressed out because you're looking at how much milk is in there and you're feeling like you're a
Mm,
failure. And so all of that is going to affect how much milk you then able to produce.
okay.
So it's something we don't say like go by, I don't know, influencer A who's got like influenza A, that's a virus. Influencer F. Don't go by that. Don't compare yourselves to other
Okay.
moms. Everybody has their own unique journey.
Yes.
Don't compare yourself like this journey with your previous child. Every baby is going to be completely different. So if you think that you're struggling, reach out for help. There's lots of help around. If you can't afford to have a lactation consultant, there's the breastfeeding helpline, 24 hours a day, 7 days a week. They're really good and they will stay on the phone with you as long as needed, like
Oh,
up to a
wow.
couple of hours if need be. And they can help you through that. There's charities that do Feeding a Lecture League. There's so much help out there. So don't suffer in silence. Um, don't think it's supposed to be painful. It's not. Breastfeeding is supposed to be an enjoyable experience.
Oh, that's lovely. Gosh. I mean, I'm probably going to write down everything you've said because it's crazy. I think there's so many difficulties we create because what we think we
Mhm.
know or what we've heard. And actually, I think just a few of those specific facts that you've mentioned could be so helpful. Um,
Yeah.
so tell us, Michelle, how do you work? I'll put your website in the show
Sure.
notes, but
Mhm.
you work both remotely and face to face.
Yeah, to do. So I cover London, Essex. Um, Sometimes I go a little bit into Kent, a little bit into Surrey. Um, I could basically go wherever I'm needed. But if it's like I'm in London, they've called me to come to Birmingham, obviously there's going to be an additional fee for me to get to Birmingham. But I do remote as well. So I've covered clients in other countries, India, Venezuela, Jamaica, and other places. So face to face, I would come to their house and it would be a 2 hour appointment. And then we would go through breastfeeding or bottle feeding or combi feeding or expressing, whatever it is that they booked for. And then I do a lot of teaching whilst I'm there with like my dolls and all of my props and stuff, just so I can show them. And then I also would give virtual support. So they would have like WhatsApp access. So they can do WhatsApp calls, they could do voice notes. I send videos of all that I've explained. or if there's something that they're struggling a bit with, I can make a video for them.
Okay.
Yeah. And I do that just virtual only as well. So if they don't need me to come and see them, they just want that like extra bit of support, then
Mm.
I can do that as well.
Gosh. Well, I think that's absolutely incredible. And I certainly wish I had known about you 6 years ago.
6 years ago, I was struggling the same way. We would have
True.
been crying together breastfeeding.
Oh, wow. Well, thank you so much. And I'm sure, this shows for a lot of new mums, but a lot of mums who will be expecting more babies. And I will certainly direct them to you and put your website in the show notes because I think it can be an absolutely life-changing experience to get the kind of
Completely,
help
yeah.
you provide.
Really. I've enjoyed it.
I've enjoyed it so much.
Thank
Thank
you
you
for
so
having
much,
me.
Michelle. Thank you.
Thank you.
So, thank you for joining me today. It's been a really informative and hopefully life changing for some of my listeners out there conversation with the wonderful Michelle Kuteyi of the Baby Care Consultancy. Her links are in the show notes, so please do get in touch if you need any support feeding your baby. And with that, I would like to wish you all the very best and all the best for your baby.